Mohawk Jewelers, timeless jewelry for generations.
Good evening, everyone. Welcome to the show Fight Against COVID 19. Thank you for liking, subscribing, and sharing our show. Thank you for being a part of the show. We were able to connect to many people who have been doing many things behind the scene or working in frontline. There are people who are making masks, supporting small businesses, and also people who are working in frontline. With this show, we are able to create awareness and connect people. Today, I have somebody who's part of Aapi, but also a frontline worker. His name is Dr. Sujeeth Punnam. Good evening, Dr. Sujeeth.
Good evening, Dr. Agarwal. How are you doing?
I'm doing fine. Thank you so much, and it's a great honor for you to be on the show.
Sure, pleasure.
So, Dr. Sujeeth, can you tell me a little bit about yourself, your expertise, and what you do?
Yeah, I'm an interventional cardiologist. I practice in Stockton, California, Northern California. We have two hospitals in our area, St. Joseph Medical Center and Dameron Hospital. And I'm also part of Aapi, American Association of Physicians of Indian Origin. I'm the incoming regional director for the Pacific Zone. I'm also associated with one of the largest medical alumni from India, which is Usmania Gandhi and Kakatiya alumni, like a Telangana alumni. And, we are in the midst of this crisis, as you know. And like everybody, I have been interested to come up with solutions for facing this. And apart from seeing patients in the hospitals, I'm also, involved in other activities like raising funds and donations for masks and things like that, and a lot of it through Aapi, actually.
So you said that you do you see COVID patients as well? I mean, are you
Yes,
is in your day to day? So tell me a little
yes.
bit about that. Right? How do you treat what in general about these patients?
So the main important thing is, as we all know, it is very communicable, very transmissible. Like right. So the main when it as odd initially, everybody had to take a back seat. Like clinics, offices have been closed. Um, Hospitals went on it in a highly defensive mode, and ERs were segregated into red zones and green zones, orange zones, some places. And then a strict criteria has been implemented about how to triage them properly. If there's any suspicion, get them tested in the emergency room. And initially the screening process was a little laborious because the testing process was taking 2 to 3 days, or sometimes in more. So once you suspect a patient with COVID, we used to have them languishing in the rooms, in the ICUs, just waiting for the results to come back. Of course, you're already treating them, but that would put a lot of uncertainties about the care. But as quickly we were able to gear ourselves back into a mode wherein, we started getting results in 4-6 hours. So that actually has eased up a lot of uncertainties. And if you go into the office sector, we started back again seeing patients in the offices, and we are implementing the same criteria that the hospitals are implementing in the lobbies, which is every visitor has to go through one particular entrance, and that place will be screened for everybody for temperature, a screening questionnaire, and only if they pass, they'll let them come. At one point, there was a thought that, just imagine hospitals becoming fertile beds or fertile ground for breeding this infection. To a large extent, I think with the methodology that we're using right now, we are able to overcome that. And one of the safest places right now is actually a hospital or an office, for example.
So, in terms of care, being a cardiologist and interventional cardiologist, what do you see in your patients, and how do you take care of them? What are some of the regimens and things like that you do? And I know that there's some component of heart involved as well.
Right.
So,
So actually, it's not a huge lot of difference. But one thing that is striking about this virus is um, a larger subset of people are developing some amount of cardiac involvement. One of it is a pure viral infection affecting the cardiac like myocardium, and so there's something called troponin we check for people if they're having heart attack or something. So a lot of these people are having abnormal troponins. What that means is there's some amount of damage to the heart muscle, but that can be of various sorts. One is just the stress of it could cause, stress induced cardiomyopathy. One is because of the stress, the plaque ruptures in the coronary arteries, in the heart arteries, and then that causes increased heart attacks. Other thing is the immune mechanism that is body is generating to fight this virus. That itself is causing myocarditis. So there are different variants of it. And also there was a recent study that came out that in Northern California, actually, the number of heart attacks have come down in this time frame. But we don't know yet whether that's true or not, because there are a lot more to the story, actually. If you look at it in our hospital, in the last 6 weeks, we have had about 35 cardiac arrests and stroke patients that came in late. Say, for example, somebody had a stroke, and in 4 hours, if they are in the window, we give a thrombolytic, right? So a lot more proportion of these stroke patients are coming in later, so they're not meeting the criteria for thrombolytic.
Oh. So what do you do then?
So you have to just treat with conservative therapy, and then some amount of increased morbidity will happen with that kind of strategy. And then cardiac arrest. Say if somebody with a heart attack comes later in their onset of symptoms, they'll have a cardiac arrest. So those patients are increasing. So what it is I'm not sure whether the heart attacks have completely gone down. It's possible, because a lot of people are resting and they're not having that much stress unless they're economically stressed. It's possible that we are seeing these people later in the course, and then some of our routine data sets that we collect to gather this information, we are missing on it. So it's too early to say anything.
And so, you're saying possibly the cardiac, injuries are less, but then you're looking at seeing at later stage. Are there other things being exposed? Like, we've heard about kidney being exposed now, more dialysis and things like that. What's going on with other, impact on other organs?
Right. So, it's not only unique about this virus, but any infection, any sepsis, which we call like a full-blown infection in the body, we call it sepsis. Any sepsis will involve multi-organ damage.
Got it.
Right. So the multi-organ damage involves, essential part of the whole body circuit is the kidneys. So kidneys tend to get affected earlier in the multi-organ failure process. And so not at all surprising to see that, you see the kidney involvement in COVID too. But that's part and parcel of any full-blown infection.
So, we also heard from Dr. Lokesh yesterday talking about steroids and other treatments. What are your thoughts in terms of, cardiac involvement and other treatments that you think may be possibly helpful?
So if we classify this in a broader outlook, if you look at it, now this is a virus infection, number one. Number two, the infection itself is causing damage to the body. Yeah. And then other aspect is the body is mounting an immune response and trying to fight it. And if it is, discordant or a disproportionate amount of immune response built, causes damage. So that's an immunological, so what that we call a cytokine storm, right? So if you look at the virus, we have an antiviral agent on the horizon, which is remdesivir. So in people who get remdesivir, they're getting better sooner. The mortality difference was more favoring it, but it was not statistically significant with the trial that we had. Yeah. But people are recovering 3 to 4 days earlier than that. So we do have a modest response there with an antiviral agent. Then what else do you do when you have this infection? Like if somebody has influenza, They have a typical viral pneumonia, and then on the top of it, superseding with like a bacterial infection, right? So if we suspect there is a bacterial infection, you start antibiotics. And then after that, the specific thing about COVID is we are testing other molecules in the body, like D-dimer, and we are looking at other inflammatory markers like ferritin, LDH, things like that. So they're elevated, then that means you have like immunological mechanism going on. And for them, there is role for IL-6. If IL-6 is an elevated, IL-6 inhibitor role is there. And then to a certain extent in China and other countries, people tried hydroxychloroquine or chloroquine to fight the cytokine storm. Now that in the cytokine storm phase, we are getting multiple studies that is showing that hydroxychloroquine, chloroquine is not helping. Now, to prevent an infection, that's a different story. We don't have information.
But more prophylactically than treatment, right?
Yeah. So the prophylaxis part of it, we don't have a verdict yet.
Yeah.
We don't know. So studies are being done. But as a treatment, once the immunological mechanism sets in, it's kind of getting a point that it's not beneficial. Mm-hmm. In fact, it could be harmful. Now, other thing is typical anti-inflammatory agent when physicians have used for decades is steroids, right? It's a no-brainer. So any time you have a point in your clinical scenario, in any infection, in any patient actually, if we suspect there is a pronounced inflammatory process going on, we do the steroids. So steroids are automatic in terms of whenever you think about anti-inflammation, you think about steroids, right? So the only question is, what phase do you start it? Is it beneficial? So some people are advocating if you use it in an earlier phase of the infection, you kind of dampen the inflammatory mechanism, anti-inflammatory process. So that would help. So again, I wouldn't say it is at a point that, we have to, but there are some proponents, but people have proposed a lot of things like hydroxychloroquine and all that. So in science, especially in medicine, a lot of things that you think intuitively does make sense, but when you really test it in the situation, it doesn't work out actually.
Yeah.
It doesn't work out. So there's nothing automatic. You have to test it and take it from there.
And study it. So tell me, what's your role in Aapi, and how are you helping in terms of Aapi, in terms, for this fight with COVID?
Yeah, so we were actually supposed to have our annual convention in June.
Yeah.
And a lot of us would have been active to, be working towards that, because there's a lot of things going to our convention, continuing medical education activities, research presentations, we have medical school student, competitions, things like that. But now everybody is in a shelter at home mode, and a lot of people, every sector, there's been webinars going on. So Aapi has been in the forefront of arranging the knowledge sharing seminars, webinars, and so I'm part of that. So we are having twice in a week, and I moderated a session on critical care for COVID. And yesterday we had a webinar which I organized for the Aapi, is how to, what is the epidemiological nuances of the pandemic. And we had, epidemiologists come in and talk about the modelings and, what kind of strategies we have to take and all that. Apart from that, Aapi, we've been working to raising funds for, when this pandemic hit us, national stockpile, the strategic stockpile was very inadequate to supply. I'll give you an example, actually. There were, our national strategic stockpile has about 30 million face masks. and about 20 million N95 respirators. And I'll put you, if you have to put that in perspective, in New York State, in 1 week, they were using 3 million masks. So that
Oh
means
my God.
about
Yeah.
1/8 of the stockpile is being used every week just in New York State,
Yeah. Yeah.
right? So we have found we sourced out our vendors, from outside the country ourselves, and so we are reaching out, and so we are doing like reaching out to multiple hospitals to provide these masks for the frontline workers, like physicians and nurses. A lot of physicians, have been exposed and getting infected. Some people are dying, and the same with the nurses and all. And we are almost in the process of reaching out, and as a token of appreciation, we're reaching out to about 10,000 nurses in the country. We are arranging, just token of appreciation, like lunch vouchers, or arranging lunches for them and showing our appreciation for them. So these are some of the things that we are doing right now.
Okay. So, I think this is amazing and very selfless work. And you're also in front line seeing the patients. What are some of the common fears in these patients who come to you in general? And how do you feel? I mean, of course, it's a scare for you as well.
Yeah, it's a definitely scary thing, even involved in any part of the healthcare, because, you never know. You're obviously more exposed to the virus than other people. So there's always a thought in your back of your mind, what is going to happen. But what can we do, right? So we cannot do anything. We have to do what we need to do. So the key thing is be careful. And one of the good thing is whatever strategies that you commonly hear, the CDC is putting out a lot of information. Everything has a very important role. Like, when we say physical distancing, 6 feet, even if somebody is a carrier or has an infection, and you stay away 6 feet and have a mask, your chances of getting infected is down to about 1.5%. So with that in mind, with appropriate personal protective equipment, we got to do what we need to do. So life has to move on.
So, any message for the viewers, anything that you want to tell them in terms of, just if they're watching, any information?
So the key things, the three key things, any n number of times we speak about these things, the relevance is very high. The three things are personal hygiene, be careful, try not to do too many things, like, do something and then pick it on the face, put it on the face. Because what you're doing is, if there is a droplet lying somewhere, you touch it and you put it in here, you're basically expediting the process of inhalation into the system. So personal hygiene, number one. Number two, social distancing, 6 feet. Say if you go to the grocery, you cannot avoid going to the grocery. So going to the grocery, the key thing is, I'm telling my patients in the office, because anybody with cardiac conditions, if they get COVID, they're going to be higher risk of mortality, of dying. So nowadays it has become a ritual for people like us. Is, we used to say, control your blood pressure, control your cholesterol, control your diabetes. Now we have added an extra thing. When you go to the grocery, make sure you wear a mask and make sure you're staying 6 feet away as much as possible from the person. Right. So if we do that, wear a mask, distancing, and personal hygiene, I think we can control this or prevent spread of it. As I said, 99% reduction in the transmission.
This was very helpful. Thank you for providing so much information about cardiac related issues and an honor to have you while you're actually treating COVID patients on the floor. And also the great work in terms of webinars and the support Aapi is providing that you're actually helping in. For example, taking care of nurses and providing masks. So we really appreciate that. It was an honor to have you on the show. And again, thank you so much, Dr. Sujeeth.
Thank you. Thank you. Thank you for having me.
Of course. Have a good night.
You too. Bye-bye.